Hey everyone, welcome to the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today I'm speaking with Dr. Michael Aragon, the Chief Medical Officer at Outset Medical. Dr. Aragon, how are you today?
I'm doing great, Jared. How are you?
I'm doing well. I'm excited for us to chat. Uh,
Yeah, absolutely.
I'd love if you could kick things off just by telling the audience a little bit about your background, and then we'll talk more about Outset Medical.
Sure. No, happy to. So I'm a nephrologist and internal medicine board certified in both. I practiced in the North Texas area for about 15 years. And while I was in practice, did a lot of home dialysis and looking at that space and how patients can care for themselves better at home with a disease process like end-stage kidney disease. Came across the technology that Outset was developing and just felt like that's where I needed to be. So I've been now with Outset about 3 years, and we've really been looking at how do we transform healthcare for patients with end-stage kidney disease.
And we usually focus on three things whenever we have a guest come on for the first time. And you don't have to go through all of them, but if you can, great. It's the why, how, what of the company. You already told us a little
Mhm.
bit about the what, what you guys do today, but can you talk us? Maybe we'll do it a little bit differently. Why you wanted to be a part of the Outset Medical team?
Sure, absolutely. So when you look at dialysis care, we've been doing dialysis really the same way for about 4 decades. We've outpatient dialysis centers where the vast majority of patients are doing their treatments. I had the distinct privilege of training with somebody who showed me how home dialysis would be different for patients, seeing how patients can take control of a disease process that the vast majority of patients just feel that they're out of control. They're dependent on others to care for themselves. So as I came across the Tablo technology and what Outset Medical was doing, here's a device that's designed for patients to care for themselves. Here's a device that's focused on the user, whether that's a nurse in a hospital or it's a patient at home. How do we make this whole process easier? And then the company itself was just surrounded by, to me, a brilliant group of individuals truly focused on a problem that really needed some innovation and looking around the space and saying, no one else is innovating. We're going to go do that. And so just feeling that passion for a group that was passionate about a patient population that I feel has gone largely ignored for decades. It just felt like the right place to be. And for me, I was in a practice in a small area of the country and felt like I could have an impact on a larger scale. So this just really spoke to me.
Yeah, it seems like a great opportunity. Love what you guys are continuing to build over there at Outset Medical. And, it's been interesting to see how things have, we talked a little bit about this before we started recording, how things have evolved in the space. And,
Yeah.
they're, hopefully we can continue to get them even evolving on par with some of the other spaces. But I know a lot of that's kind of out of everyone's control, right? But we can go into that more later. One of the things I really wanted to focus in on with you is let's talk a little bit about the COVID-19 pandemic, and you know, as a result, hospitals have been stretched beyond limits in treating influxes of critically ill patients, uh, and a lot of those patients require dialysis. Can you talk a little bit more about this and kind of and maybe how, as things are getting a little bit better, how that's changing?
Sure, sure. I think when we see natural disasters or these really critical times where you'll have a surge of patients, you can stress a hospital for a short amount of time, but usually that is a passing thing. I think one of the biggest challenges with COVID has been the duration of this. Right, we're several years in. So while early on we would see patient surges in certain parts of the country, and that would strain nursing staffs in certain areas, as this has continued to go on, we've seen worldwide supply chain being affected. We've seen these nursing staffs that have been working, incredible hours for this incredible duration now starting to, move into other areas of healthcare or it's created staffing shortages. It just makes it harder and harder to care for this population. And these outsourced providers, so typically dialysis in a hospital, the majority of that has been done by a dialysis provider that's providing the nursing staff and equipment to hospitals. Those providers have also become stressed. They don't have the staffs or the supplies to be able to provide these hospitals with care. So as this has gone on for so long, what we've seen is hospitals that now have a larger number of patients with a shorter number of staff. The supply chains are stretched. So these equipment that are dependent on sterile bags of dialysate or highly specialized cartridges and filter combinations Now they're not able to get the equipment they need. They're not able to have the staff that they need to care for this patient population. And so now we start seeing these patients suffering in that they go to the hospital looking for care, and that may be very delayed. It may be very difficult to provide that. So it's actually to the point that the National Kidney Foundation and the American Society of Nephrology have been petitioning the federal government to try to get additional help, state governments, local governments, to try to see if there's any way we can try to help these hospitals and these patients get the care they need.
And I want to talk more about, we'll stick, just because we're still, even if we're not hearing as much about it, we're still very much, the pandemic is still not over, right?
Right.
There was a recently released US RDS 2021 annual basically report survey, which pointed out that dialysis patients' treatment in clinics can result in deadly exposure to COVID. Can you talk more about this? Like, was this in your experience? Was this true? Is this something that this report was accurate?
It's for the first time in about 50 years, we've seen the dialysis patient population actually shrink. And unfortunately, it's not because we've had this increase in transplants or we're doing better in delaying the progression. What we've seen is, for all the reasons that I just mentioned, the challenges in trying to care for these patients in the traditional model, which is a dialysis clinic and hospitals. Now we see patients having shorter treatments, missing treatments, patients being concerned about being in a dialysis clinic where there's another 12 or 24 other patients being exposed to COVID. So now you see this challenge of worsening treatment. It's harder to deliver it. And again, we saw the death rates as far as patients that had COVID, if they had end-stage kidney disease. You saw, unfortunately, an increased mortality rate in that population. And even when we look within that population, if you look at the report, it'll show that patients that are treating around other patients, for example, patients that have to treat in a skilled nursing facility, have a higher mortality rate than those patients that were dialyzing at home. So you have an at-risk population, a weakened immune system that comes from having kidney disease, and now you're putting those patients together in our traditional model, and we're just increasing their exposure. Unfortunately, they have a much harder disease course than a healthy individual. And our model actually cohorts those patients together. So it really has been a big problem. That's why we've been so focused on trying to change that model and help patients protect themselves while still getting the treatment they need.
So when I was telling you a little bit about, you know, years ago, my grandfather went through dialysis. So whenever I'm able to have the conversations with anyone that's in the space, it's very interesting to me because I heard from his experience, and even we were talking through, right? It's been probably about a 10-year period. There's still, like, whether it's at the speed that we want it to or not, there still has been vast improvements in the space over that period of time. Now, one of the things that was definitely, and this was common even before, the last 10 years, but it's definitely picking up steam, was home dialysis. Can you tell us more about how home dialysis and how Outset Medical is basically changing the dialysis landscape, and
Right.
basically, where am I going with this? Revitalizing the treatment experience for patients with Tablo.
Sure, sure. So when we look historically at dialysis in the U.S., you look at as dialysis first started, right, in the 70s and 80s, the majority of patients were doing dialysis at home. Over the decades, we've transitioned that model to patients. The majority of patients, 88% of the population now dialyzes in a dialysis clinic. So as I mentioned, you're bringing patients together. They're on a very specific shift. They're dependent on professionals to provide their care. But what we've seen historically, and we look at the USRDS data as well, there's been studies to demonstrate this as well. Patients that dialyze at home have a higher quality of life, more likely to be able to remain employed if that's what they want to do, feel better. We've seen reduced hospitalizations. And so what we've seen over the last several decades is now this refocus back on how do we help patients dialyze at home? How do we get them to be able to be more empowered in their care? Which I think across healthcare, we've done more consumer-based, consumer-focused healthcare. As you look at wearables and things like that, we're trying to help the patients be more informed and care for themselves. And so what we did with Tablo, which is a product that it's an all-in-one solution. It really simplifies dialysis for the patient. Every bit of every step of the treatment is on a screen and video and written guidance, so we can very shortly train someone to be able to take care of themselves, and then provide a device that is very automated, so it makes it very simple. So what we're trying to do, and what we've been doing over the last few years, is empowering patients to take back control of their care. So in this pandemic, obviously, it makes even more sense. Not only do we have patients that are activated and patients that are empowered, but they're also helping protect themselves from potential exposures to other patients that may have illnesses or may be infectious. And so, what Tablo does, whether that's at home, whether it's in the hospital, just makes dialysis easier. It's easier to use, it's easier to learn, much more simplified process. And so, we feel like that helps us care for this population. And the pandemic just highlighted the need to do that quickly and more efficiently.
Can we shift, I guess, focus towards the future of dialysis care,
Absolutely.
real quick, and then part two of that. So let's start with like a generic view on your mind of what the future looks like, and then maybe tee up what's next that you can share in terms of Outset Medical.
Yeah, I think where dialysis and I think all of healthcare is going is to a more patient empowered, direct to patient education, direct to patient, technology to help them again be able to own their own healthcare. In the middle of this pandemic, we've got supply shortages. We don't have all this extra staff to be able to do this, so it is coming out of necessity that we're accelerating that. Uh, in addition, what we see is the traditional model has been take a patient who needs to start dialysis. The vast majority of them have to go to the hospital to start that therapy. Then they end up in a dialysis clinic, and then a small percentage may move to home. We think there's a completely different model here where even if patients need to start in a hospital, they can be directly trained straight to home. Why go into that clinic if patients are in chronic kidney disease and progressing towards dialysis? That ability to provide a technology that's easy enough, help with that education process. Why not have patients go directly to home? And so the Tablo, as I mentioned, very very easy to use product. We have seen some focus from CMS, Center for Medicare and Medicaid Services, to try to focus on improving home therapy. So they did have a traditional add-on payment and basically designated a technology that's a substantial clinical improvement would be reimbursed favorably to try to help that adoption. Tablo is the first device ever to get that designation, and so you can even see from a payer perspective, from the government perspective, we're trying to encourage this patient empowerment. So we believe all of that is going to help us drive care into the home. And we're just going to continue to focus on how do we help patients become more informed? How do we make it easier and easier for them to learn about this and be able to fit dialysis into their life as opposed to the other way around where they're trying to work their lives around their dialysis treatment.
Well, Dr. Aragon, I'm really excited that we were able to have you come on the podcast, and hopefully we can have you and other members of the team on again real soon to dive into some other areas around dialysis. But really appreciate your time here today, and can't wait to keep following Outset Medical.